in a sense, they almost mean the same thing. So basically, there are conditions which can be inherited through genes. And so basically, an inherited condition, another word for it, is a genetic condition, and those are what we tend to call familial conditions. If it's not genetic, then it's usually called sporadic. So it's just arisen in this one individual. They haven't inherited it from, anywhere else. So what would trigger our suspicion would be, for example, a patient who develops a second neuroendocrine tumor, a patient who has a family member who's also had a neuroendocrine tumor, and or a patient in whom we measure serum calcium and it's elevated, and I'll explain that. One of the main conditions we find with genetic conditions with patients with neuroendocrine tumors is a condition called multiple endocrine neoplasia type 1. And in this condition, most patients will develop parathyroid adenomas. So, and these tend to cause high calcium levels. So certainly in all patients we see with particularly pancreatic or bronchial neuroendocrine tumors, we would always recommend measuring the serum calcium, and if it's elevated, then that will trigger further investigations, including possibly a genetic referral. Multiple endocrine neoplasia type 1 is a condition in which patients develop multiple what we call neuroendocrine or endocrine tumors. And particularly in type 1, the most common sites for developing these tumors are parathyroid glands, so parathyroid adenomas, pituitary adenomas, and pancreatic tumors. So the pituitary gland is a small gland which sits just underneath the brain. And if I may demonstrate, if you did that and that, where your fingers cross, that's where your pituitary gland sits. There are other conditions. For example, with von Hippel-Lindau syndrome, you can get pancreatic neuroendocrine tumors, and there are very likely other genetic links which we're not yet aware of, which may play a role in neuroendocrine tumors. So pheochromocytomas are tumors of the adrenal gland which secrete excess amounts of adrenaline type hormones. Now sometimes these tumors can arise in other areas away from the adrenal glands, and in those cases we call them paragangliomas. Now we're certainly aware that probably around a quarter of these pheochromocytomas or paragangliomas do have a familial link, are inherited, and over the past 2 decades, there's been a large number of mutations which have been found, new mutations which have been found which predispose people to developing these tumors. So we certainly know conditions like multiple endocrine neoplasia type 2 can be associated with pheochromocytoma formation, but this can also be the case with other conditions like von Hippel-Lindau syndrome, neurofibromatosis, and more recently we found about mutations in the succinate dehydrogenase genes. The adrenal glands sit on either side just above the kidneys. In fact, they sit on top of the kidneys. When a patient's diagnosed with multiple endocrine neoplasia type 1, then obviously what we then embark on is looking at the rest of the family, at the close family members, to work out which parent the patient has inherited it from, but also many of the people in whom we make this diagnosis will have children of their own, and the question often arises, what should we do, at what age should we test them? Now normally the way we make the diagnosis is with a blood test looking for a mutation in the menin gene, and once the mutation has been found, that's the mutation we look for in any other family members. Specifically with children, we work quite closely with our pediatric endocrinology colleagues, and what we generally recommend is that the genetic testing should be done around adolescence, when the children get to the point where they're starting to understand what the testing will mean for them. Obviously, there are exceptions to this, and we do know that in certain rare circumstances, the condition can manifest before adolescence. But in most cases, it's in the second decade, second, third decade of life that you get the first manifestations, and so we will often try and delay the testing and not do it at birth. Whereas with certain other familial endocrine conditions, we will recommend testing, when the children are very young, because there are interventions which will make a difference. Yes, there's ongoing work in many centres around the world where they're looking at various genetic factors associated with neuroendocrine tumours and all sorts of other tumours as well.